If your doctor has mentioned metformin for insulin resistance and you have been wondering whether it can actually help you lose weight, you're not alone. This is a common question that I hear, and the answer is more nuanced than most people realize. Hi, my name is Dr. Basma Farris. I am a board-certified OBGYN with expertise in PMOS, formerly known as PCOS, a chronic health problem where insulin resistance is key, how it connects to insulin resistance, and what kind of weight loss you can actually realistically expect. First, let's talk about insulin resistance itself. Insulin is a hormone your body makes to help move sugar from your blood into your cells for energy. When you have insulin resistance, your cells stop responding to insulin the way that they should. So your body compensates by producing even more and more insulin. Here's the problem with that. Insulin is also a storage hormone. Higher insulin levels make it easier for your body to store fat and harder for your body to burn it. Over time, this creates a frustrating cycle where gaining weight becomes easier and losing weight feels almost impossible, even when you're eating well and exercising. That is where metformin comes in. Metformin is a medication that has been used for decades, primarily to manage blood sugar in people with type 2 diabetes. But it works in several ways that are especially helpful when insulin resistance is part of the picture. At its core, metformin improves insulin sensitivity. That means it helps your cells respond to insulin more effectively, so your body does not need to produce as much. When insulin levels come down, your body shifts out of that constant fat storage mode. That alone can make a meaningful difference. But metformin does more than just fix insulin signaling. It also reduces the amount of sugar your liver releases into your bloodstream, which is often elevated in people with insulin resistance. It increases levels of a gut hormone called GLP-1, which helps you feel full after eating. And recent research has shown that metformin triggers the release of a protein called GDF15, which acts on the brain to naturally reduce appetite. So it is working on multiple fronts at once. Now, here is the part where I want to set honest, realistic expectations. Metformin is not a dramatic weight loss drug. In clinical studies, the average weight loss with metformin is around 3% of body weight. So if you weigh 200 pounds, that's roughly 6 pounds. About 25 to 50% of people taking metformin achieve 5% or more weight loss, which is considered clinically significant or meaningful. In one major long-term study called the Diabetes Prevention Program, people taking metformin maintained about 6% weight loss over 15 years, which is actually quite impressive for sustained results. The weight loss tends to be more noticeable in people who have significant insulin resistance, such as those with prediabetes, type 2 diabetes, or PMOS, formerly known as PCOS. In fact, studies in women with PCOS have shown that metformin not only helps with modest weight reduction, but also improves insulin resistance, lowers testosterone levels, and can help restore more regular menstrual cycles. The benefits tend to be greater in those with a higher body mass index. Results are not instant. Most people begin to notice changes over the first few months, and the full effect typically becomes clear around 3 to 6 months. Doses at 1,500 milligrams or more per day tend to be associated with the greatest benefit for weight management. Let me also mention side effects because they really do matter. The most common ones are gastrointestinal, things like nausea, bloating, and diarrhea. These are usually worse when you first start the medication and tend to improve as your body adjusts to it. Starting at a lower dose and gradually increasing it helps a lot. There is also an extended release version that many people tolerate better. One thing to be aware of with long-term use is that metformin can lower your vitamin B12 levels, so your doctor may check that periodically. Here is something important to understand. Metformin works best as part of a bigger plan. It is not a replacement for healthy eating and regular physical activity. Think of it as a tool that helps level the playing field. When insulin resistance has been working against you, metformin can help remove some of that metabolic resistance so that the lifestyle changes you are making actually show results. It is also worth knowing that metformin is not FDA approved specifically as a weight loss medication. When doctors prescribe it for weight management or insulin resistance without diabetes, that is considered off-label use. That does not mean it is unsafe. It simply means the primary approval was for blood sugar control in type 2 diabetes. Metformin has one of the longest safety track records of any medication in this space, and it is widely available and affordable. So to bring it all together, metformin can help with weight loss in insulin resistance, but the effect is modest. It works by improving how your body responds to insulin, reducing appetite, and lowering excess sugar production in the liver. It is most effective when combined with lifestyle changes and tends to show the greatest benefit in people with significant insulin resistance. Results take time, usually a few months, and the weight loss is gradual and sustained rather than rapid. Every person's situation is different. Your medical history, your metabolic profile, and your goals all matter. If you are wondering whether metformin might be the right medication for you, that is a conversation to have with your healthcare provider. They can look at the full picture and help you decide on the best approach. I hope you found this helpful. Remember to hit like and subscribe for more evidence-based health information. And if you have questions, drop them in the comments so I can do a future educational video on the topic.